So here we have an interview with Fadhil. Um, if you want to introduce yourself real quick, that would be awesome.
Yeah, my name's Fadhil Hussain. I'm a current third year DO student at Ohio University Heritage College of Medicine. Um, I started the internship in the summer between first and second year, so that would be 2022, I believe. Um, and yeah, I did the internship 2 years ago now, I think.
Okay. Fadhil, what made you passionate about concussions in the first place, and what made you want to intern with Concussion Alliance?
Um, so I sort of started in undergrad when I was before I was a pre-med student, actually. I was sort of exploring all sorts of healthcare fields, and I started a research opportunity, and it just sort of happened to be with the Head Injury Research Center at Cincinnati Children's, because that's where I got an opportunity, and I started doing concussion research there, and I really, really enjoyed it. And sort of just that was a starting point, and from there forward, I've been interested in concussion research and sort of diving deeper and deeper into it as time went on. Um, so that's sort of how I got interested in concussions in the first place. And as far as sort of why I chose a Concussion Alliance internship is because I was sort of looking for something to do between that first year and second year, that summer in between, in medical school. And I was sort of looking at various opportunities and just searching for concussion related opportunities, and I found it, and it was just really unique. Um, and it seemed really interesting. And it also sort of had that patient advocacy piece, which was important to me because that was something that I cared about, but something I hadn't necessarily been directly involved with in the past. I had sort of been more on the research side, so I wanted to try something new and interesting. And I really identified with their mission, so that was a big part of it once I started learning more about it.
Yeah. So how did, I guess, Concussion Alliance help with that patient advocacy part, and I guess what kind of perspective regarding concussion research, and what I guess yeah, like what kind of new research did you uh uncover with your externship or your internship with Concussion Alliance?
Yeah, so for me, the patient advocacy part and how that sort of fits in is like obviously there's a lot of scientific out information out there, but it doesn't really do any good if it doesn't get to the people that can do something with it. So for me, that was the important piece. Like what good is clinical guidelines if they don't get to clinicians, especially quickly? And what good are new resources if they don't get to people who need to use those resources, or who could benefit from it, even if they don't necessarily need it? Um, so there's sort of like that gap that exists, and Concussion Alliance sort of fits in the middle and helps bridge that gap. So that's something that I'm really proud to have been a part of and continue to be a part of with writing for the newsletter. Um, so yeah, and as far as like what new research I sort of discovered by working with the both the internship and as a newsletter writer, I've just learned a ton about sort of what the evidence-based protocol is for treating a concussion, um, especially because I think there is a gap between sort of what the research says and what's actually being done. And a lot of that is because concussion is one of those things that's sort of treated in a primary care setting when clinicians, whether it's like emergency medicine or your primary care physician or urgent care, they have so many different things that they have to sort of be up to date with that certain things can sort of fall behind and lag a little bit. Um, so that's where I feel like the Concussion Alliance's mission, what they want to do, really fits in because it sort of takes a bit of that burden off of the clinician to like read all these things and keep up themselves, and the Concussion Alliance can sort of help them keep up with what's new and how things are changing over time.
Yeah. Did Concussion Alliance help put you in contact with professionals, whether it was expert guest speakers or with other extern or interns that you worked with?
Yeah, for sure. So I spoke with Dr. Sandel. She is very involved with the Concussion Alliance, and then also wrote the book Shaken Brain. So I spoke with her after my internship experience, and spoke sort of more specifically about my career goals with her, and she was really great in helping me sort of align my goals for the next couple of years and get an idea of what steps I can take to pursue my goals of matching into PM&R. She's a PM&R physician. She also introduced me to like what the brain injury medicine specialty is about, which is something I didn't even know exists before speaking with her. And then sort of we talked also about some of my longer term career goals. Obviously, right now I'm a medical student, but sort of as I go in through matching and then beyond that, if I want to do a fellowship and sort of finding my niche into like concussion care, she was really helpful in sort of showing me the roadmap of what things I can do to push myself in that direction.
That's great to hear. I guess with regard to the work you did during your internship and with the like the newsletters, I guess like what made you want to come back with the newsletters, and were there any like I guess specific projects or newsletters that you wrote that really stuck out and resonated with you?
Yeah, so there are actually a few that have stuck out with me. What made me want to come back, I just really wanted to stay involved because again, I really care about the mission. So I wanted some way, even as like medical school got busier and my time sort of became more limited, the newsletters are a really great way for me to stay involved and sort of contribute when I can. Um, and so yeah, one of the newsletters specifically, or one of the synopses that I wrote that stuck out a lot was when it was a study sort of finding causality between repetitive head impacts and CTE. That's something that's sort of been in the news for years now. But that one article in the synopsis I wrote on it really stuck out to me because it established that causal link that had sort of been cloudy at least in at least early on a few years ago. Um, so yeah, that one really stuck out because it was my first synopsis that was sort of it did cover the research, but then there was also like a call to action piece of it that organizations, especially sports organizations, need to sort of take charge and understand that there is a causal link and understand how to make that link known and mitigate subconcussive hits and just sort of make it more of a real issue that people understand before they participate in things that might have higher risks of these kinds of things.
Yeah, that's really important. We recently read the sixth consensus report, which is kind of, it has its issues because a lot of it's funded by sports organizations, and it like I think it came out last year and it said that CTE does not have a causal link to subconcussive hits. So I guess how do you think that we could I guess move towards like expanding knowledge about this causal link and having healthcare professionals provide educated care, and how can we make changes to these sports? I guess this is kind of a big question, but is there any, do you see your career path kind of aligning with that specific issue within traumatic brain injuries?
Yeah, for sure. So, I mean, as far as what the Concussion Alliance can do and what we as sort of members of the organization can do as we sort of move through our careers is just making sure it's known, like not stopping talking about it, making sure that people are always aware of what's going on and how the risks of these repetitive subconcussive hits, because like people don't really think about what happens if you don't get a concussion, but they add up. So just keeping that awareness and then everyone in the internship involved with the Concussion Alliance goes on to do great things in healthcare, whatever they decide to do, but just sort of pursuing that and continuing that dialogue and bringing awareness to it. And then as far as what I hope to do in my career is I really want to end up in sort of a niche where I'm taking care of patients who have concussions or suffering from concussions and other head injuries. Um, so I don't know yet if that means sports medicine or if that means brain injury medicine or what exactly that's going to look like. But I do want to be in the space. Um, so as hopefully I grow in the space and I sort of further my career, I want to help educate more people and sort of bring them along my side as I learn more too, to just keep advancing that care and helping people understand both the risks that come with engaging in things that might increase your risk for head injuries, and then how to manage them, I think, is also a huge thing, because at the end of the day, you're not going to have people like no head injuries ever, like they're going to happen. So understanding how to recognize them and manage them is also hugely important. So that's something that I really want to focus on as I grow in my career.
Yeah, that's awesome to hear. Yeah, I mean, that's kind of all the questions that I had that I wanted to answer. So I'll stop the recording. Let's see. I'm not exactly sure how to do this.